This is Boomer Life on CL 650.
Welcome back to Boomer Life, the prophets of rhythm. And I changed my mind as we're talking about the mind, specifically the human brain. And our guests from Neurokinetics Clinic in Vancouver here on Boomer Life are the founder and medical director, Philippe Souvestre, and clinic manager, Sonia Dale, is also with us. And we're going to talk to a former patient in a couple of minutes. Duane is going to join us in a couple of seconds. But we were just talking during the break. We mentioned this on the last occasion that you visited us here on Boomer Life, Philippe. Sometimes, and I've learned this from my legal friends in the personal injury business, because they represent people who have been brain injured severely in the legal context. But they've told me that in many cases, a person who has suffered a brain injury is not particularly aware of it and tend, if anything, to really underestimate the seriousness of the injury. Is this something that you find in your practice as well?
Yes, it is a constant. Actually, it is one of the parameters and the paradigms of this particular condition. We have to remember that trauma is neither an illness or the result of an illness or the result of a disease.
Right.
It is a third entity which is extremely particular in the field of medical practice.
Okay. So, and this is why, Sonia, when you have people coming into the clinic for that first visit, it's something. They'll make a phone call. They'll go to the website, neurokinetics.com, and they'll get the contacts after hearing you on the radio, for example. They'll go, oh, okay, why don't we give these people a call?
Right.
You prefer, if someone is coming to you with a brain injury, that individual be accompanied by someone, a friend, a family member, something like that, for a variety of reasons, not the least of which is to back up some of the information. So if you say to that person, so how are you doing today? How are you feeling? I feel great.
Yes.
And the family member will go, maybe not so
Maybe,
much.
yes.
And
yes.
so that's important, isn't it?
Yes, it is. It's very important. And it's also for support for them. I mean, throughout the process, a lot of times what happens is, like Dr. Philippe was saying, they underestimate themselves. So when they have that moral support and they have that friend or family member sitting next to them,
right,
it helps them realize what the actual problem is and to help them address the real concerns and symptoms.
Right.
Yes.
Okay, now we're going to get you in a few minutes to walk us through the process
Sure.
of being brought into the neurokinetics environment.
Sure.
But first, Philippe, I'm looking forward to this conversation. A former patient of yours is about to join us. Duane Anderson is on the line. Duane, hello.
Hello.
How are you today?
I'm well. How about you guys?
We're doing fine. Say hello to Dr. Philippe and to Sonia as well.
Good morning, Duane.
Hi, Sonia.
Hi, Duane. How are you?
I'm great, thanks.
So, Duane, how long ago did you become a patient at the Neurokinetics Clinic?
It was January of 2014 was the first time I went in to see Philippe at Neurokinetics.
Okay, now what was the nature of your visit? What brought you to Philippe?
I've been struggling for kind of several years with the ongoing effects of concussions. I'd suffered many concussions and head trauma from a lifetime of playing sports and, being young and abusing my body in general and stuff.
Mm-hmm.
And I'd been left with I'd had a recent concussion that I could not recover from, couldn't return to work from, and so I ended up reaching out to Neurokinetics and going in there for help.
Now, was that most recent concussion, the one that kept you from going to work, was that sports-related as well, Duane?
No, that one was actually a bit of a freak accident, Sterling. I hadn't been feeling well for a couple of years, and I'd flown out east on business, and on my way back, a passenger on a plane pulled a oversized luggage out of an overhead compartment and dropped it on my head.
Oh, ouch.
It was a bit of a freak accident, yeah.
But that aggravated an already existing situation.
That is exactly what it did. The actual impact wasn't that great, but it did aggravate some symptoms and some troubles I was already living with.
Now, Duane, you said that you had been feeling poorly as a result of all of this sports activity and so on for a couple of years before you went to see Dr. Philippe. Had you seen other medical types in that 2-year period?
Yeah, I'd been in to see several doctors with and kind of present my symptoms and try and get some help. And what had happened there is, I think, people were pretty well intentioned. There was kind of two streams that kind of resulted. One was, if I'd had another concussion and stuff, it was the rest and time will make it better. Or the other one was well-intentioned people kind of misdiagnosing you. I had a lot of symptoms, so I was misdiagnosed with problems with my neck, problems with my back, heart problems, all sorts of issues, right?
And so by the time you finally got to the Neurokinetics clinic, you'd sort of bounced around a little bit and received very little satisfaction by the sound of it, Duane.
Yeah, that's an accurate thing. Very little satisfaction, a lot of frustration, a real frustrating feeling when you know kind of what you're living with, and
nobody seems to get it.
Nobody seems to get it, and it's not that they necessarily don't care. Some of them really did and wanted to help and stuff, but the truth is they just didn't get it, right?
Okay, so now I'm sitting across the desk from your doctor here. So, Philippe, when Duane showed up at the clinic, and this is a pretty typical story in the sense that, as we've said many times already, Neurokinetics tends to be the clinic of last resort. It's where people end up, they've gone around and around and around and no satisfaction. So Duane arrives at your clinic. And Sonia will walk us through the protocols of the intake. But once all of that was accomplished, how did you get started?
Well, after having collected all the data and information required to design the structured program we use to restore brain dysfunction, which usually are very commonly observed after concussion, a head concussion.
Right.
We discuss the situation with the patient, we debrief, and we present what will be the line of attack, if I may use that terminology.
Sure.
And and discuss the strategy, the treatment strategy. We think in terms of incapacitation. Symptoms are helping, but the loss of function is paramount.
Right.
In a case of concussion, as it is in a case of any mild or severe traumatic brain injury.
Well, in Duane's case, the pain, particularly after he had a suitcase dropped on his head, got to the point where he couldn't go to work anymore. Exactly. So he shows up at the clinic, and this, I suppose, is an advantage in a strange way to Sonia and you, Philippe, because by the time a patient like Duane, who has already told us he's been to various doctors and sought advice from various sectors, by the time they arrive to see you, they've amassed quite a dossier. So they bring to you a fairly large amount of information.
Always. And we request that as well.
Okay. So how long, Duane, did it take for you, once you were speaking with Dr. Philippe, to figure out, hey, this guy gets it? I've been seeing all these other people, and nobody got it. And all of a sudden, I'm sitting across the desk from this guy, and darn it, he gets it.
I would say the first time I showed up at the clinic, Philippe and I had a discussion about my medical history and kind of the trauma I'd been through, the symptoms I was experiencing. And within minutes, I could tell that Philippe understood what I was talking about. Some of the symptoms, a little bizarre and stuff, he would explain them to me right away. He even led me down the path of saying, do you have these sorts of issues, and stuff that I hadn't even necessarily consciously even noticed. And he understood kind of the global picture. And it literally was within 15 minutes I understood that I was in good hands and that finally someone got what was going on with me.
What an enormous relief after 2 hours of going around and around and around. Duane does sit down and to finally have someone who at least understands what the heck you're talking about.
Yeah, it was a landmark step is to have that understanding. It was the real first step of my recovery, is to know that someone understood what was going on, and it provided, some relief and also some hope that, better days were ahead.
Well, that's an interesting combination too, isn't it, Philippe? The ability to provide to the patient, first of all, the knowledge, the information that here's what's wrong, and now here's what we're going to do to make it right. So it's both knowledge and hope.
Yes.
So how long did it take for you and Duane to organize his particular customized program?
It took three-step assessment, each session being between 3 to 4 hours in length, plus a couple of hours, up to a couple of hours of personal work outside of patient side. So hours piles up during the assessment, but it is a worthy time spent to understand what is going on.
Okay, and once all of the assessment is completed, and a pretty thorough diagnosis of the problem has been identified, then you can move on to the therapy, correct?
Exactly. Yes. Understanding is everything.
Sure.
Understanding for the practitioner, of course, which then is able to reverse engineer what the trauma has undone, and identify the limits to the recovery, if any, under the form of obstacles or under the form of damages sometimes, which complicate the picture. But understanding all of these whereabouts are key to do the right thing.
And Duane, as far from your side of the desk, coming into the clinic, and first of all, just experiencing the enormous relief that finally you're sitting opposite a medical professional who gets it, who understands what you're talking about, who's even suggesting symptoms to you that you hadn't paid any attention to because you were busy paying attention to other ones. So all of a sudden you're there going, wow, okay, so now we're going to have a couple of sessions in which all of my medical history is going to get discussed and all of that, and then we're going to organize a program. How long did that take before you were through the full assessment, Duane, and then got to your first actual hands-on therapy day?
The assessment was done over multiple days, and we did it pretty quick, and I think the treatment started roughly within about a week. Is that right, Philippe?
Yes, it is.
Okay.
Yeah.
And how frequent did you have to go to the clinic for treatments to begin with, Duane?
2 to 3 days a week I would go for about 3 or 4 hours. Well, about 3 hours at a time.
Okay. And what sort of exercises does one do, spending 3 or 4 hours a day, 2 or 3 days a week? What does one do during those hours in order to try and restore brain function?
Nothing.
Oh, really?
Yes. The patient is required to do absolutely nothing. It is all about medical stimulation, biomedical stimulation, acupunctural stimulation, and monitoring of what is going on from a physiological standpoint, most importantly from a brain physiological standpoint, and we are monitoring the situation and its evolution through measuring and assessing brain physiological parameters, general physiological parameters, psychological parameters, cognitive parameters, and so forth.
Okay, so Duane, that one couldn't have been too hard a mission to accomplish for you. I need you to show up and do nothing for 3 or 4 hours. Okay, Doc, I think I can handle that, right?
Yeah, that's right. I could definitely handle that. It was an interesting thing because one of the questions I always ask too is, as you're healing or trying to get better, is, you know, you got this in your mind that you should be doing crossword puzzles or exercising
exactly,
and those sorts of things. And one of the things that really helped as the treatment started was the ability to sleep, because one of the symptoms I had that's pretty common with concussions is I had a brain that was not operating the proper way. It was a little chaotic. It didn't like to shut down. I had a lot of trouble sleeping and getting good rest. So early on in the program, I started to be able to rest effectively for the first time in a long, long time, and that really kind of helped kick off the healing process as well. I think Philippe would agree.
Isn't that interesting, Philippe? Because one would think, and Duane certainly from a layman's perspective, I think articulates what most of us would do. Oh, my head hurts, my brain might be injured. But gosh, I better start doing some brain exercises, like Duane says, crossword puzzles, or I would watch Jeopardy twice a day. That kind of thing. Just work out, get that brain going. And you want the exact opposite. You want this brain to finally settle down.
Yes, and there's a good reason for that. As human beings, under the governance of brain controls, which I won't enter the details today for time questions, we are physical beings, we are cognitive beings, we are emotional beings, we are intellectual beings, and we are also, out of all of these, executive performers. Spontaneously, the brain is a very active engine.
Sure.
Constantly, and he will not ask you permission to do something.
Sure.
It is the mystery of life, part of what I call the mystery of life and survival. But when we get hurt, a lot of chaos will occur in the between the connections of those controls, and will, out of their losses or dysfunction or potential damage, but in any case loss of proper function,
Right.
symptoms will rise. And this is why you, after such a concussive trauma, patients commonly, or we as human beings, commonly present simultaneously apparently unrelated physical symptoms, cognitive symptoms, emotional symptoms, intellectual symptoms, and executive disorders, which means we lose performance. The word incapacitation in traumatology is a key word.
Okay.
It comes, even in my eyes, before symptoms. Symptoms are alarm signals that say a lot, but incapacitation is paramount.
Duane, how long into the therapy program of allowing your brain to just breathe a little so you could catch a bit of sleep and all the rest of it, and so that even just being able to sleep somewhat normally, suddenly life levels off a whole lot. So how long did it take you to go through the program to the point where you achieved the sort of satisfaction you had spent 2 years trying to find unsuccessfully?
Well, I would say that I'd been struggling for even much more than 2 years.
Okay.
And after seeing Philippe, the results were basically instantaneous with the rest and the clearing of the mind, and that. And the greatest results were probably early on, and then after that time, I still had issues. I still had symptoms. Stamina was a big one.
But you were able to understand more about what was going on, I guess.
Absolutely, yeah. And understanding was a big thing because I'd had all these symptoms. A lot of them I didn't recognize were connected, like cognitive symptoms and physical ones that I thought were completely separate. So that understanding was powerful, where Philippe kind of unified everything together for me to understand that, this is real, this is substantiated by objective testing, this is what's going on with you, and this is the program that's going to help get you better, right? So
almost out of time here, Duane. How long did the program last, this intense treatment with Dr. Philippe?
I think we were around 14 weeks or so.
Okay. Several occasions per week over about 3 or 4 months.
Yeah, and the frequency and kind of intensity, the frequency for sure kind of tapered off as my health improved over time.
Great.
Yeah.
And are you still a patient, or do you make infrequent visits, or are you all better, Duane?
I feel much better. I still have a little issues and stuff. I don't live in Vancouver right now, so when I visit Vancouver and stuff, I definitely stop by for infrequent visits.
Good.
What I'd say is a little tune-up there.
Okay.
Yeah.
But all things considered, the experience of the Neurokinetics Clinic and Dr. Philippe's approach has been an enormous difference in your life.
Absolutely. 100%. You bet.
Well, it's great to talk to you. Thank you so much for joining us today. It's Dr. Philippe and Sonia both sending you just huge smiles. So their thanks to you as well, Duane. Great to talk to you.
Thank you,
You bet. My pleasure. Thanks.
There's Duane Anderson, a former patient, a success story, one might say, of the Neurokinetics Clinic. In Vancouver, by the way, at 3195 Granville Street. That's in the Highcroft Medical Building, right there just at the bottom of the hill on Granville Street, heading down into the busy section of town. They're online, by the way, at neurokinetics.com, or, Sonia, the shortcut website, the easy-to-remember web address is
renewme.ca.
renewme.ca.
Back with lots more on Boomer Life after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.